Hi, friends, and welcome to the Autoimmune Mom Podcast. I'm your host, Allie. This is a space for moms navigating life with autoimmune disease, the exhaustion, the guilt, the strength it takes to show up, and the hope that we can still live full, meaningful lives even when our bodies make things harder. Each week, we'll have conversations with moms living with autoimmune disease, share practical support, and remind each other we are not alone in this journey. Before we dive in, if this podcast resonates with you, it would mean so much to me if you would follow or subscribe wherever you're listening, leave a review, share this episode with another mom who needs it. Instagram, Facebook, and YouTube at the Autoimmune Mom Podcast, where I share encouragement, resources, updates about new episodes. Looking for extra my free Autoimmune Mom Survival Guide through the link in my bio. Let's get into today's episode. Hi guys, welcome back. Quick update on today's episode. I had some technical issues with my recording. I'm still dialing in how to do a podcast and how to be a podcaster and how to figure this whole thing out. So unfortunately, some of the content is a little bit wobbly. I did the best I could. Mariah's information and message is so beautiful that I just don't want to not share it with you. So if you could just work through that with me while I'm figuring out exactly how to do this and how to get better at it. I'm not tech savvy at all. I'm just a mom who wants to connect other moms. So I really hope you listen through and that you enjoy Mariah. And you got to check out her website, Mom is Facing Forward, and her Facebook and Instagram page, because she's a gem and she's got a ton of information for expecting mothers out there that is extremely valuable. It just didn't exist when she and I were having our baby. So anyways, thanks so much for your support. I hope you enjoyed today's show. Welcome back to the Autoimmune Mom Podcast. Today I have a very special guest with me all the way from Colorado. This is one of my favorite parts about a podcast is I am meeting people all over the world, really. And Mariah is a very special guest. We have a very lot in common. And she is a mom of 3 in the Colorado area. And she's a writer. And she also is doing a lot in the space of moms with autoimmune disease. So I'm very excited to hear your story, Mariah. Thank you so much for being here.
Thank you for having me.
Oh, you're welcome. Like I said, we do have a lot in common. So let's start with your story. Let's start with your early symptoms to diagnosis and what that looked like for you.
Okay. Well, I was 25 years old and I was in the middle of a dual degree program at the University of Colorado. Excuse me. I was working on a law degree and a master's in environmental science. And, I was busy. I was active. I was a snowboarder. I joined the university club water polo team, like in my spare time, just for fun because I enjoyed it. And then my symptoms came on kind of slowly one by one, and they were kind of excusable at first. Like first it was my toes, and I had like hurt one of my toes by dropping something on it. I was like, oh, well, something went weird with how it healed. And then it was my fingers and my wrists. And it was the middle of law school finals. I was on my computer hours and hours and hours. That's all it was. I thought it would get better at the end of the semester, but it didn't get better. And then my knees swelled up of grapefruit, could hardly walk. And, I was in a way very lucky that I got diagnosed very quickly with rheumatoid arthritis after that. So it has been since this my journey since I was 25 years old.
Okay. Do you mind me asking how old you are now?
I'm 43.
Okay. Similar. I was diagnosed at 29. I'm 47 now, and I was an athlete. And you just excuse the pain when you're an athlete. There's no pain, no gain mentality.
Yep.
There's always a reason why everything hurts. We're stressed. We're working. So you had a quick diagnosis. There was no denying it was rheumatoid from
of months. I went from excusing these weird symptoms to like full blown every joint, go see the rheumatologist. In fact, when I was first at student health, because I was a student and I had student health insurance, and so I was at the student health. I remember that the doctor actually asked if she could bring in a training doctor to touch my finger joints because I was so typically presenting. She wanted the training doctor, what it was like.
That's fascinating. When I was first diagnosed, I was being seen at a hospital in Boston, and it was an educational hospital tied to Harvard, and we had the
Mhm.
same exact situation. I was asked to go to Harvard and be a guest at a lecture. So I sat in front of a rheumatology group of kids who were taking it, and I was pregnant at the time, and I gave my story to all these like 20 something Harvard kids because of this presentation was so obvious at first. And now I was a pregnant woman and how to treat a pregnant woman. And we'll get into all of that, I'm sure, with you because you went through the same thing. So you're 25 now. Had you been dating at the time?
So I was living with my boyfriend who then became my husband later, but we were living he's been with me every step of the way, but I did after at first, I don't think I realized what the diagnosis meant, I think I thought, "They're gonna give me some medicine, I'm gonna take the medicine, I'm gonna go back to class." Like, it was not the impact didn't hit me until later, and I did. I went right back to law school in the fall, and it was rough. Like, and I had never struggled so hard to keep up in school before, like, that was my thing. Um, and so once I kind of figured out the impact and how it was going to be, I did offer my husband a chance to leave the relationship because I felt like I had to, because I felt, like I have for the rest of my life, but you don't necessarily need to do that. And obviously he made the choice to stay, and 3 kids later, here we are. But it was a scary kind of moment of, wow, this is not how we envisioned our lives going.
For sure, and I don't think people talk about that enough, and it sounds like you and I, have this in common that the men that we chose at that time, because we were not married either, we were engaged. There's a lot of men out there who don't understand this when their partners are suffering through it, and they the support that I think what you're saying had and I had. It's a huge blessing, like,
Mhm.
I don't know how people I think it's a gift to find somebody who can champion you through that.
Sometimes
Sorry,
I
go
think
ahead.
that the husband or the partner deserves a little more credit than they get because it does impact their life as well. And I don't think, people think about that. And so I think they deserve credit for
They
that.
really don't, and I say it all the time. I wanna get my husband on the podcast to talk about his experience. We've done my kids, and that was
That
eye-opening
would be
for
an
me,
interesting
and I
one.
think
Yeah.
to have him come on and, he's my ultimate champion and will do anything he can to help me out, especially when it comes to this kind of stuff, but, it's not easy. There's a layer of it
It
to a
is not easy,
marriage and
for
to
sure.
children that the normal person, I hate that term, but doesn't see or hear or understand, so, well, that's amazing. I'm glad he stuck around. Uh,
Me
so
too.
walk us a little bit about, what you felt or what you thought about when you made the decision to have children.
So, I basically, I was in that dual degree program and I finished it and I got to the end of school and we got married right about that time. Sort of looked at things and I thought, well, there's the family path and the career path, and I didn't think I could handle it all at once given the way my health was. And so we chose to focus on starting a family. And, my oldest is turning 14 next week. And so, 15 years ago, wasn't any sort of resource for me when I started looking for information on rheumatoid arthritis and pregnancy, or even just any sort of chronic illness and pregnancy. Like, if you Googled that, you sat down and Googled that, you would get statistics on what, complication rates are higher, and they kind of like encouraging you not to do it. And I just really really wanted to connect with someone who was a parent and was living with a chronic illness, but at the time there wasn't even really social media the way there is today. So
Mhm.
there wasn't a whole lot of information or ability to connect. And so I did feel pretty isolated. Then, I had friends who were having babies at the same time who were like going through new motherhood things, but there were some really unique challenges that I was facing and it felt like it all on my own. Um and so that's ultimately why I started blogging and writing and talking about this, because I thought, well, maybe if I put my story out there, the next woman won't feel quite as isolated as I did.
Felt the exact same way. I actually tried to do a blog for a little while because I felt the same exact thing. Like I know there's got to be people out there, and you're right. social media wasn't the same. It was kind of like in the forefront of
Mhm.
Facebook and things like that.
Yep.
And, you just didn't connect. But I did attempt at a blog and I just found I was trying to get the word out there. And it was almost being in some of these groups on Facebook or social media groups can be a dark place because the people that are there are
It
really
does. It
they're
can.
suffering and they're searching for
Mhm.
answers, and it can be very dark and isolating, and I wasn't in a good place physically and I needed to take a step back from it. Um
Mhm.
so but that's what happens. People, they're dark, they're in a bad place, they go on the internet, they kind of spread it without knowing they're spreading it. And then you get better and you feel better and you don't go into those groups and you don't share as much because you're feeling better and
Mhm.
you're out living your life. And it's these types of things, what you're doing, what I'm doing, it's trying to connect us all back together and kind of keep it a little bit light. And I'm trying to, anyways, make it as positive as possible. It is a very dark and depressing disease, but especially rheumatoid. But yeah, there's a space for community for sure that's lacking, I think. Um, and so thank you for doing what you're doing.
So I started blogging and I connected with a few people that way. And then as social media started becoming more of a thing, I did start a Facebook group called Mamas Facing Forward to connect parents and parents. I originally started out supporting women, but now the group is open to anyone who's a parent living with a chronic illness. Um, and you're right, like it is something I work really hard at is to keep that group from not being a depressing place. Like we've worked hard. We've come up with kind of slightly different rules than other groups. And we do focus. The whole point is facing forward, like figure out like, okay, here we are. How do we keep going? And not focusing so much on the downsides. Or if we are asking for help about the downsides, we want to know like, okay, how do I keep facing forward? Like what can I do here? And sometimes, you're facing forward for like a week time you got to get through. But I think as long as I always feel as long as I'm pointing in the right direction, I'll get there eventually.
Couldn't agree more. No, it's so easy to look back and I used to be like that, and I miss that.
Mhm.
So I love the facing forward mentality, because it is a struggle, but there is some positivities that can come out of living a life like this. You're raising kids in a very different way, and I don't know about you, but mine are more empathetic, compassionate, understanding of people. They take time uh, to
Definitely.
notice how other people are, and I think that's a beautiful thing. And if I have to have a little bit of suffering to make them better humans, I guess then that's okay for me. Um, But let's talk a little bit about your pregnancies. When you had your babies, did a lot of people go into remission, that type of stuff? Do you feel pretty
No.
good? No.
I mean, I'm I know there are people who go in, certainly not one of them. Uh, First pregnancy was, back 15 years ago, there wasn't as much data as there is today, medication use. So back then, the kind of best advice was basically stop all of your meds and hope you go into remission. Good luck to you. Um,
Yeah.
with my first, I did not really go into remission, but I managed. I did okay, during that pregnancy. I did have a really strong postpartum flare. And so it was a very disappointing thing for me, even though I knew it was likely and I was prepared. But I clawed my way to breastfeeding for 3 months because I really wanted to. And again, at
Mhm.
that time, they were saying there's no meds. And then my second pregnancy, I started out the same way on no medications, and then my RA flared like worse than it had been in a very long time. And actually, I had to make the decision to go back onto a biologic at the end of that pregnancy, even though the data was not that great to support such a decision at the time. So that was really scary. And so one of the things I always recommend to people is that even if you're thinking that you want to try to go med free and see if you go into remission, because people do, I always
Yeah.
place for what you would do if you don't go into remission, if you do flare, because I had to make that decision while I was 6, 7 months pregnant and and it was awful. Um, and then for my 3rd baby, the data had changed a lot by then. I actually joined studies to contribute our data to showing which medication, since I had taken a medication during my second and third pregnancy. My third, I switched to a pregnancy safe biologic prior to conception and then stayed on it the whole time. And that was by far my easiest pregnancy. And I was able to kind of breastfeed more.
That's amazing. They just kept me on low dose prednisone the entire 2 pregnancies that I had.
That was basically the
I
only option at that stage.
Yeah, exactly. And I was not happy about it, but I've never been in like a clinical remission ever. So pregnancy didn't put me into remission either, but it was not terrible, I have to say. Like I did feel, who knows if it was the prednisone or what, but I didn't feel terrible. I just hated being pregnant. And
Well,
then
that's the thing is that,
postpartum,
like, everybody you might go into remission, but pregnancy has its own set of symptoms and weird things and pains and aches and
yeah,
stuff, so it can
exactly. It's not
by
what it
itself.
is. Yeah, exactly. So I always find it interesting. Postpartum flares are definitely a thing I hear about a lot. I definitely suffered from them. In fact, I think so far those are probably some of the most challenging years of raising a child, of having a family, was the postpartum flare and just the constant. A human life is dependent upon you, whether you feel good or not, and
Right, right.
you have no there's nothing you can do. And I did have support with my husband and my family, but, you know, you wanna do it the way you wanna do it, and you don't want someone else raising your baby either. So, interesting to
Right.
hear what you think about what some of the harder seasons of parenting have been for you.
I agree that that postpartum flare period is really challenging. It's particularly with your first because, like, you don't know anything about being a parent. You're learning how to be a parent at the moment. And for example, like the breastfeeding decision felt so hard because when they're little, all you do is, feed them and change them. And that's pretty much all of parenting. And so if you're not able to
Mhm.
do that the way you hope, feels really bad. Maybe when I had the postpartum flare and I did as much breastfeeding as I could. And then I was like, okay, well, I'm going to switch him to formula and he's going to be fine because his brother was fine. But the first time
Yeah.
around, everything just feels so heightened and like any decision you make that's wrong is going to scar them for the rest of their lives. But you know what? It doesn't. And there's so much more to parenting than, just how you feed them or what happens in those first couple of months. Um, but I think before you know that, it's really hard to kind of give yourself grace.
1,000%. You're doing this for the first time, and I struggled with the breastfeeding thing, and it nearly killed me. I was like, "I'm failing as a mother already." Mother for
Yes,
a minute,
it's what it feels
and
like.
can't even do the one thing I'm supposed to be naturally biologically told like able to do. I can't even do that.
Right.
That is a real
Well, and I think a lot
hard.
of people don't understand that. I think a lot of people don't understand that feeding there's a learning curve. It's not like whoop, and now we're not like you just know how to do it. There's a learning
Yeah.
curve. And if you're
There
not
for
prepared for
most
that, then it's even more scary.
I had a sister-in-law who was like kinda like that. She just like her baby's latched and she's having babies at the same time I'm having babies, and I was like, "This is not we are not the same," like, "This is hard." So yeah, the comparison thing for sure. I, however you raise your children is the right way for you and your family, and that is my
Agreed.
main like, learning curve at the very beginning was very difficult for me because I had this thought in my head that this is what it's gonna look like, and I'm gonna do this. This is the
Mhm.
job that I know God wants me to do, and I'm gonna do it perfectly. And then it was like, this is not how it's happening at all. Um,
Well, then I think we sometimes forget to factor in and a different person and they have different needs. And so what you thought was going to work might not work for them. And so it really is like kind of a learning experience. And I do think that that picture in your mind of like what it's going to be like, it's hard to get away from that. It's okay to change your mind at any time while parenting because you don't, try something different if it doesn't work. And in a way, I think living with chronic illness prior to becoming a parent sort of made me a more adaptable parent because I was used to sort of pivoting and not having control of the situation all the time and having to like listen to my body and do, change the plans or whatever. And I think some of those skills are really applicable to parenting for sure.
you can't plan when you have these diseases that we have. you can't plan too far ahead because you don't know if tomorrow you're going to wake up feeling one way or the other. And
Mhm.
what a that and you don't know if your kid's going to wake up cranky either. So it's that I've never had anyone say that like that before, and I really love that perspective. That it kind of laid the groundwork for being a better parent, or a more adaptable
I mean, in a
parent, I
way, I
guess.
really think it did. And like, even just the relationship that my husband and I built, like treating my chronic illness as a shared problem that we had to, work together on, and like our communication improved. And then all of that was transferable to being a parent too. And, sometimes we have to tag team things. Sometimes one of us feels okay, the other one doesn't. And we were doing
Hmm.
those things to deal with the uncertainty of my illness before we were parents. And now that we're parents, those skills are still really useful.
How do you approach it with your children? Have you always talked
You
about it
mean,
from a time they were?
yeah, I think at an age appropriate level, we've always sort of talked about it. I always think of it's not like a conversation with a capital C that you like sit down and have one time and teach them about. It just comes up naturally in day-to-day life, and we talk about it a little bit and then we move on. And if they have questions, I answer them and then we move on. Sometimes you're like, I'm gonna have this serious conversation and I'm gonna share this really hard thing, and they're listening for 5 minutes, and then 2 seconds later they're like, do you think it's gonna snow?
Yeah.
So you want to provide them with the information that they need. And we sort of treat it's everybody's well-being in the family matters, and so we talk about the different needs that each person has. Also, there are some decent children's books out there about various chronic illnesses, and some of them, like, even if you don't have the specific illness that the book is talking about, can still be really useful to like read with little kids and they might be experiencing. And so we do reviews of those children's book up on our website, so you can see if you think a book might be a good fit for your family situation, because that can be really helpful sometimes too. Because the
Oh, I'm
kids' feelings about my health, and they don't like it when I don't feel well for multiple days in a row, or like if I have to slow down when they wish I could participate, or things like that. So I think it's important to acknowledge and talk about, and so it's just kind of a part of our world.
Yes, agree. And I think about how it's shaping them because on the opposite end of the spectrum, my mother, her father had not an autoimmune disease, but he passed away young from severe heart disease. And it just was something that like she was worried about from the time she was a baby. This is why I always talk to my kid,
Hmm.
like not a baby, but like a young person. She was always worried about her father passing away and passed away in her 20s. Uh, but of her childhood where that wasn't a worry of hers because he had this horrific heart
Hmm.
disease issue. And so I think about she talks about that now and I'm like, okay, but they didn't back in 1960s they didn't talk about with their children
Yeah.
the family health. It
It was a
wasn't really
different
something.
dynamic for sure.
It was for sure different and what that did to her. So I'm very cautious about, okay, I don't feel good today. That's fine. I'll be better in another, a day or two or whatever it is. But we do talk, we do spend time, we do acknowledge it, but we don't use it as a huge excuse. Like I do have to take the time, but I still have things I have to get done and I'm still doing them on a daily basis and next family down the street. And that's okay. And
And that's a
I think
conversation we have a lot about,
yeah.
how our family doesn't have to look how other people's families looks. Every family is unique.
For sure. And that is kind of across the board with the way we eat, the way we prepare meals. Like we don't have a microwave because I've read a bad thing about that. We don't do this. And that's my kids think their friends think we're weird. And I'm like, that's fine. They can think we're weird. I'm okay with that. This is what we do in our family, and that's fine. Every family is different. So yeah, I think that that's all very valuable and the more we talk about it to our kids, the more we normalize it, the more normal again with that word, but the better they will be in the end of it all.
I also find it to be a good way to model self-care to my kids, talk about how I'm taking care of my health or listening to my body, because I do think a lot of moms, they take on everything and then they forget about themselves, and I want my kids to see that I am also person with needs and feelings, and I want to show them how to themselves. And so
Right.
when I am struggling and feeling like guilty or feeling like, oh, I should be able to do this, I should be able to do that. Of course, my husband's always, don't should all over yourself is his
Yeah.
refrain. But I think in those moments, if I think about it as I am modeling self-care to my kids, that makes it a little easier for me to kind of put my own needs first, which is easier said than done as a parent.
Well, absolutely. But what a valuable lesson because I don't know how you grew up, but my mom was going, 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 going all the time. She had 5 kids. She was working, she was going, 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 and that was modeled for me, and it wasn't a bad thing. But throwing an auto cannot do that. And part of the reason I was even in this mess is because I wasn't paying attention to what my body was telling me for years. So I agree with you that this is um kids are getting a different perspective on life that hopefully will help them better than maybe I did. But I think you nailed it. It it's really wonderful to teach your children self-care. It's not something our society wants them to learn at a young age at all.
Right. And I sort of hate the term self-care, just like normal is not quite the right word either. Self-care is not
Yes.
quite the right word because sometimes that feels like another thing on your to-do list that you're supposed to do. But I do think it
Well, I
is,
I think
for
society
lack
said
of a better word, it is important.
yeah, because society will tell you self-care is go to the spa and get your nails done, and that's not the self-care we're talking about. We're talking about resting when you need to, eating whole foods, you know, do whatever it is, but it can literally be I need a day in bed, and that's my self-care. So not
Right. Right.
although getting your nails done can be fun. I'm not saying you shouldn't, but it's totally different.
Well, and I'm sure you've heard, how on the airplane, the flight attendants will say, put your oxygen mask on first before helping your child. That's not my favorite metaphor because I could definitely, there are situations where I'd be like, oh, I'm going to help my child first. And that's to the detriment of you. Like you physically could put your child's mask on before doing yours. So the one that I
Yes.
like is that you can't pour from an empty cup because
Yes.
that one, like if your cup is empty, it's physically impossible for you to give to anybody else. And so that's the one I use to remind me is that I have to make sure there's something in my cup before I give to others.
I use that same exact analogy. It's kind of crazy. Uh, so what do your days look like now? Now that you have older children, they're not in babies and diapers and all of that. What do you
Yeah,
what do they look
it's a new and exciting stage where my youngest is 8, and so like they can be unmonitored temporarily, and they're not going to kill themselves immediately. It's a whole new stage. Now the challenges are more like keeping up with homework and staying on top of assignments and staying organized, and those are things that we're working on in our family. 2 middle schoolers this year, so that was a big. I've got one going off to high school next year. And I think we're kind of learning to function in this new stage. I spend a lot of my own time doing writing and working on this particular topic has been my kind of passion topic. I'm right now working on a book proposal for basically a guide to pregnancy when you have chronic illness. Because if you go into a bookstore and you pick up a pregnancy book, it assumes good health as a baseline and then tells you everything you need to know about pregnancy. But that's just simply not the reality for so many of us. Um, and so I think a resource needs to exist that's like, you are considering pregnancy? What questions do you have about your own health along that process? So I want to give people resources on, how do you make decisions about medications? What questions should you ask your doctor? Like what you do if you're if you're struggling to conceive. I remember when I was trying to get pregnant the first time, the only resource I could find about pregnancy and arthritis was this book. It was called Arthritis, Pregnancy, and the Path to Parenthood. And it was written by a woman living in Australia. So I ordered the book all the way from Australia, and it was wonderful. Like that was the closest I got to like having a real person be like, you can do this. But I remember she skipped right from like, here's what you talk to your doctor before you conceive to And now that you're pregnant, here's what you do. And there's a whole stage in between there that's challenging for people. And if you're living with
Mhm.
pain or you're not on your usual treatments, like that's a challenging stage. I think there are gaps, the resources out there for people who are living with chronic illness. And that's what I'm hoping with this book to fill.
I think that's beautiful. I would have loved to have something like that. I had a my first pregnancy was a miscarriage, and I know, like, I was young and I didn't ask the doctors, if I'm being honest. Like, I just was kind of like deer in the headlights, especially when it came to pregnancy and babies. And like, I just remember having this aha moment after I lost the baby that was like, well, obviously, I don't, my body is a disaster right now. Why would I ever think this was a good terrain to house a child for 9 months? But no one had ever really talked to me about that. I never really thought about it. So then I had to do some work to get my body like calmer, quieter.
Hmm.
But yeah,
And
just
that's an
I,
important can do. Yeah.
yeah. Yeah, for sure. And then when I had my other daughter, it was, I went into it with wide opened eyes and more realistic about it all. I was also very paranoid because I had a sister that passed away from SIDS. So I was all like so scared and so nervous for so many years. And that's not a good environment to be, pregnant. And it's just that fear was so real. And so I think that's a beautiful thing. And I look forward to reading your
I mean,
book,
I just
even.
see there's so many unknowns when it comes to parenting and moms in particular, I think get a lot of judgment for the decisions that they're making. And like in reality, everyone deserves to feel supported for the decisions they make that are right for them and their family. And like there are some great resources out there, but they're not that easy to find. So
Yeah.
I think it would be better if not only like I don't know if you had this experience. I certainly in my pregnancy had I just have my rheumatologist. I'd have a question, and my rheumatologist would say, "Oh, I don't know. Ask your OB." And then the OB would say, "Oh, I don't know. Ask your rheumatologist." And I was left in the
Hmm.
going, "Well, I'm not a doctor. How am I supposed to know who to do?" Um, and so, like, later with my 3rd pregnancy, I learned about, maternal fetal medicine specialists and MFM doctor.
Hmm.
It's a high risk pregnancy doctor, which sounds scary. You're like, "I don't wanna think
Yeah.
of my pregnancy as high risk," but all it really means is that they are specially trained to deal with more complicated pregnancy cases. And so on my 3rd pregnancy, I was able to consult with one and, like, get the help and support that I needed to, like, answer those questions and feel confident about those answers. And so I think there's information that people who are considering, the path to parenthood might want to think about, on their way, and it's not necessarily going to be offered by their doctors because sometimes the doctors are not educated. The rheumatologist may not have ever had a pregnant patient before, and the OB even has never even heard of the medication that you're on. So
Yes.
it can be a
That
challenging
is
world for sure.
absolutely, that was my experience for sure. And I think it's just a symptom of a larger problem with the medical community. Like, no one looks at you really as a whole. It's whatever you're there for.
Mhm.
And you have to try to navigating it all together is very difficult. But I think it's especially true for
And it's a
young
lot of work.
expect
It's a lot of work to stay on top of like your own healthcare. And then when you throw the baby in too, like that's even more work. And so if I can offer some kind of guidance based on what I've learned, and also I have had the opportunity to work with some researchers, talk once asked to present to the FDA, the Food and Drug Administration, about what it's like. So I think I'm hoping to educate both patients and providers and like make it an easier process for people with chronic illness who are considering pregnancy.
Well, this is amazing because one of the first interviews I did was a young girl, and she has already had one son, but she was hoping to have another. So I definitely want to connect you guys because I think,
That would be
first
great.
pregnancy did not have rheumatoid during her first pregnancy,
Hmm.
and that is something that
That's
happened
pretty
in between.
common. Yeah, getting diagnosed after a kid is pretty common too.
Pretty common. It's got to be something with the body and the hormones and the stress. I think stress is really undervalued or underappreciated. Valued is the wrong word. Underappreciated for what it does to our bodies.
Right.
I know for me, it is my biggest trigger by
But
far.
I hope you will connect us because like I think there's some like magic in being able to connect to parents who actually understand what you're going through. And that's what I think the Facebook group that I work to try to keep as positive as possible, but it becomes this like hive mind so that each of us isn't like reinventing the wheel all by ourselves for every little problem that we face. Um,
Right.
and people really come together and share resources and share ideas. I always my example is always that years before I ever had a girl myself, someone came onto the group and said she was having a really hard time putting her daughter's hair in a ponytail, and it was, it's impacting how she felt about herself as a mother. It was impacting her daughter's self-esteem. Like what? And it seems like such a small thing, but like it mattered to this person, like that she was struggling with this, and she's like, "What can I do?" And I didn't have the answer for her because I didn't have a girl, and I hadn't had tried to put a
Mhm.
ponytail in anyone else's hair. So, but people from the group popped up and said, "We'll try this product," or here's a video of this technique, or even just solidarity. Like, I have had this problem too, and it sucks. That is so meaningful to someone who is struggling. And that's the aim of the group, is to kind of lift each other up and learn from each other's experiences so that we're not doing it all on our own. Because it can feel really lonely when you're surrounded by parents who are functioning better than you are.
1,000%. I have that same exact memory of me trying to brush my kid's hair and I can't do it. And then you drop them off at preschool and so and so's hair
You
is
feel
like
judged. You feel judged.
flowing, beautiful. And I always struggled to get their boots on that day. And, like, and you do feel so isolated alone, especially if you're suffering and going through these seasons in the winter when everybody's locked in the house anyways, and you don't get out as much. I can remember that when we lived in Boston up until 7 years ago. So you're so right. It's very isolating. It's very lonely. You feel like people are looking at your kids weird because you didn't get their hair, whatever it is. So I think that your Facebook community and your book and all of that it's beautiful. Really, there's no other way to say it
Well,
because it's very
I
much needed.
actually I love what you're doing with the autoimmune mom, because that was something that I discovered slowly. Was that at first I thought, "Oh, I can support other moms who are living with rheumatoid arthritis." But as I got to know other people, I realized that it doesn't really matter what your exact diagnosis is. If you're living with a chronic illness, we have so much in common. Like, there's a lot of people in our group who are living with IBD, like whatever it is, like we're facing a lot of the same challenges as parents. Some of us are, even some of the medications are the same. The the
Yep.
the barriers to getting those medications are the same. Like the guilt we feel about having to skip events is the same. And so I love that you're doing the autoimmune mon, because there are so many different specific diagnoses, but I think the content is still relevant to everyone, regardless of your, not everyone, but regardless of your diagnosis.
Well, with it, I often say, people who are diagnosed yet, um, especially moms, and they're asking these questions. They're trying to find it. They don't know what they have. They think they're going to get their diagnosis and everything's going to be fine. As you were saying, I'll take this medicine and I'll be
Mhm.
fine. And
Yep.
that's sadly
And maybe you
almost
will.
I
Sometimes that
know.
happens.
But it's like high
But
90% chance the first medication you take is not going to be the
right,
answer to all of your
right.
problems. And does it really matter what the label is if you feel like if you're can't get out of bed, or you know what I mean? Like that's why I did autoimmune, because it doesn't, the label of whatever it is, most of the time it doesn't matter if it's rheumatoid or if it's irritable or ulcerative colitis. Like, you're miserable, I'm miserable. We're trying to raise kids, it
And we have a
and
lot
we
in
need.
common across it.
Yes, and women lift each other up and support each other all the time in a million different ways. And this little area that we're all, or this little club that we're all in, is not a fun club, and people don't want to talk about it. But once you do start talking about it, you realize there's a lot of people out there in this boat, and they're all quietly
Mhm.
suffering. Um,
Yeah.
I think it's great. The more community we have, the better. Do you have any practical parent survival tips that you might share, for when you're in a flare? That's a
Sure.
tough question.
Let's see. One thing that I did when my kids were little, that really helped me a lot, was to use a system of toy rotation, which meant that only a few of our toys would be out in the playroom at any time, and the rest were stored in a closet somewhere. And the way that this helped me was first of all, there were fewer toys to pick up every time the playroom was a disaster. Right? And then, but the beauty of it for me was if I had a day where I felt yucky or, needed a little bit of extra help or I didn't have a lot of energy, I could pull these like, quote unquote new toys out of the closet and put them out in the playroom and they would be more engaging. I don't know if you've experienced that, but somehow like, that toy that no one's touched and you're about to donate it to charity because no one's touched it for 3 months. And then suddenly it's the most exciting toy ever. And so you them gave me the opportunity to make exciting toys magically appear anytime I needed them. And then I'd put the other ones away for a while and then a few months later they'd come back out as the toys. And so I think we got really good use out of all of our toys that way, and it gave me like just a sort of boost. Um,
I love that.
the other thing I would say is I don't I most people probably have heard of Brene Brown of her work at all.
Yeah.
She's a shame researcher, and one of her books is called The Gifts of Imperfect, ways to live a wholehearted life and how to basically kind of what things to let go of society's expectations. And so one of her things that has really helped me is she talks about how being busy and being engaged and doing stuff all the time is kind of seen as a status symbol in society, to just be doing all the time. And she talks about, well, why don't we let go of that, put some value on rest and play and activity? And our family has really kind of embraced that idea of like, we don't have to do everything that everybody else is doing. We can reserve some time for ourselves, for rest, for play, for family stuff. So, for example, my kids, I have friends whose kids are doing 2, 3, 4 extracurriculars each. My kids are not. They're each doing one that they're interested in. Sometimes we change to a one. I don't feel as if we're limiting them, but we're making the choice to like focus on things that they're really excited about and then preserve some of our time as a lot of commitments.
I think that's great. We do something similar. We meet our kids where they're at in the season that they're in, and we support them through the one activity that they are into at that moment. That's a trip to Barnes and Nobles because she wants to get a new book or something. Like that's it. If it's a sport, we do that, but we don't overschedule either. I can't. I physically can't do it. And I think there's value in rest that's underappreciated in this society that we live in for sure.
And even personally, I have like looked at what my kids' friends are doing and thought, oh gosh, am I holding them back? They instrument, they didn't start a sport. They did like, am I holding them back? So reading this passage from Brene Brown really helped me be like, no, it's okay to make this choice of what I know is right for my family. It's better for all of us if we protect our time, if we kind of give ourselves the space to just be together and have fun and, family on the weekend because we're not running around to 19 different games. For us, it's made a really big difference. And hearing her words, which were based on research, and I think my like kind of student academic brain was like, oh, well, if it's based on research, then it's good. It made me feel better. So that's a
Well, and also the longer you live with these illnesses, the more you realize that slowly, if you're really paying attention, you cannot burn the candle at both ends like this. You pay the piper at some point, and I think it's great to teach to your kids at a young age. We do this. Like if one of my kids is into sports and the other one isn't, and that's fine. We do run around a little bit with
Mhm.
sports, but that's because that's her goal right now.
There's
And
always
as
some
soon as
running around for sure.
soon as that's over, we're done with the soccer. I'm done. But yeah, I think protecting your peace. You have to in this world.
Mhm.
Um, Here's a good question for you. How are you finding joy inside of the craziness of motherhood with autoimmune?
You know, I guess I've never known motherhood any other way. So it has always been a part of my journey. I knew it would be from the beginning. I think, and this sounds cliche, but I find joy in the little things, in the time that we spend together, in the little activities that we get to do that matter. I I really enjoy. My family likes to take pictures a lot, and I really enjoy like making little slideshows each year of all the wonderful things that happen because pictures are usually of happy events. You don't usually take a picture of yourself on your worst day. And so it's
Yeah.
nice to think back and like see all the things that experiences and that kind of validates the choices for me to look back and see the fun and joy and the experiences that they've had, regardless of how our family is different from other families.
When you're like, when I'm having a down day, I'll often flip through my phone and look and just smile at
That's a
what
good
they
it's
were
a
when they,
good it's a good pick.
scroll on Instagram or something. You can just look at what you built and enjoy it. Um, because it is hard when you're not feeling good, but there's a lot of good out there. So, one last question for you. If you are talking to a young woman who's considering having a child, what's your number one piece of advice for her?
A woman with an autoimmune or chronic illness.
Yes, yes. I'm sorry.
I mean, I think maybe this is the same advice to anyone is to I think obviously you can't plan for everything in parenthood or pregnancy, like, and stuff is definitely not going to go according to your plans all the time. But I think as far as like if you're considering pregnancy with a chronic illness, it's really important to understand all of your treatment options. Whether you want to try to go med free during your pregnancy or not, like it's still really important to understand your options. And it's important to make sure that those options are the most up to date ones because that data changes really fast. Like I had, my oldest is almost 14 and my youngest is 8. And even in that span, I had completely different options with my third pregnancy than I did with my first. So you want to make sure there's a really great organization called Mother to Baby that researches exposure during pregnancy. So they have the most up to date data on which meds are safe for pregnancy or breastfeeding and which are not. And you want to make sure that your doctor is giving you the right information because you have to kind of do your home, you have to check your doctor's work because they're not always completely up to date on that. And so understanding your options is really important. And then planning a little bit, plan for the possibility of a postpartum flare. See what you can put in place in advance to make things easier after the baby comes. Of course, you won't know exactly what you'll need or exactly what it will be like, but if you can put some meals in your freezer or set up a meal train or the one that I think, right after a baby is born, usually about 6 or 7 weeks later that postpartum flare appears. And by then help being offered is kind of tapered off. So if you can sort of
Hmm.
reserve some of the help that your friends or family might be able to be willing to give you for a few weeks after, I think that can be a really good strategy too to help get through that patch.
I've Yeah, absolutely. And being willing to take the help. I struggled with that. That was a very difficult thing for me.
That's a hard one.
I don't like asking for help. Um, and I think I just was
Asking
clueless.
is
I
really
had no
hard. It's
idea. Yeah,
no, I think asking
for
for help is
sure.
really hard. And the way I got better at that was I started by accepting help when it was offered. Um,
Hmm.
my mom would be like, "I'm gonna unload the dishwasher," and I'd be, "Oh no, it's fine. I can do it. It's fine." But instead of saying, "No, it's fine," I would just say, "Yes, yes, thank you." Whatever help was offered, and once I got used to kind of accepting the offered help, it became easier to say, "Well, actually, what would help is this," because people will say, "Let us know if you need anything. What can I do? Let me know what I can do to help," and that kind of puts the burden on you to figure out how they can help, and that's challenging. But if you can think of some ways that people might be able to help you that you can give to them when they offer, um, that can be helpful too.
Even
Like
just
we'd
telling
really appreciate
people,
a meal, right?
right? Even just telling people in the forefront of it. I didn't know. They didn't know. No
Mhm,
doctor ever mentioned it to me. I didn't think to research it. I just didn't know. And so no one really knew to check in. I laid nothing out. I had none of that. So I think just being prepared and like knowing is half the battle, as they always say. But
mhm.
um, I think, yeah, asking for help, knowing that you might need it, and accepting that is a big,
And I
big.
think like if somebody really cares about you and they're offering help, like you letting them help you is an act of love. Like they're showing that they love you. Allowing their help is showing that you love them.
They don't wanna see you like this. They wanna
Mhm.
you need to bless them by letting them help you. So that's how I had to try to reframe my brain. It's like, this isn't really, it's about me, I need the help, and my baby needs the help, but also they need to feel that they are helping and, doing something and help and contributing in some kind of a way. So it's a two-way street.
Yeah, and the truth of the matter is all moms, every single mom ever needs help, regardless of what their health is like, if they have a chronic illness or not. Like in that, especially in that newborn, they all need help. And I think knowing that and saying, okay, I will accept help through this period is, a powerful step in like taking care of yourself. Model
And your
self-care to
baby.
that baby. Yeah.
Yes. I mean, I think at one point my thought was like, okay, I don't want this help, but my baby needs this help. So I'm going to swallow my
Right.
pride
And
and take it.
yeah, framing it that way is often a helpful way to
Yeah.
because it is really in the baby's best interest to have you as healthy as possible. So what do you need to do that for your baby if you can't do it for yourself?
Right. Right. Yep. That's what got me around to it. But yeah. Well, Maria, I really enjoyed this conversation with you. I think we have so much in common. And too bad we didn't meet 15 years ago when we were both
I
going through
know,
this.
right? Glad to have
But
found you now because this is such a cool resource that you're creating.
thank you. Yeah, if you know of anyone who has a story that they'd like to share, would love, love, love the
I will
opportunity
put the
to
word
read
out.
that.
Yeah.
And I'm definitely going to connect you with um uh gosh, I can't think of her name right now because I'm on the spot and my perimenopausal
That's
brain
how
and
it
my
works.
autoimmune brain are
That's how it
combining.
works.
Um, but I'll connect you with her and anyone else that I come across for sure. I will put obviously in the show notes your Facebook and website. And yeah, I think I can't wait to read your book. I'll definitely read it, even though I'm out of that stage.
Well, it doesn't
For
exist yet. It's just in a proposal stage, but hopefully it exists someday.
it will exist someday. I know that for sure. Before we wrap up today's episode, I just want to say thank you for being here and spending this time with me. If this conversation resonated with you, it would mean so much to me if you'd follow or subscribe to the Autoimmune Mom podcast wherever you're listening, and take a minute to leave a review. It really helps other moms who are navigating autoimmune disease find this space. And if you know of another mom who might need to hear this message, please share the episode with her. You can also connect with me on Instagram, Facebook, and YouTube at the Autoimmune Mom Podcast, where I share encouragement, resources, and up-to-date updates on new episodes. And don't forget, you can download my free Autoimmune Mom Survival Guide using the link in my bio on my socials. Remember, you're not alone in this journey, and I'll see you next week at the Autoimmune Mom Podcast. Take care of yourself, Mama. Your health matters too.